I'm Amanda Olson from IntimateRose.com, and I'm a physical therapist specializing in pelvic floor rehabilitation. And a very common question that we see at Intimate Rose and that I actually see in the clinic is that folks are having a hard time maintaining the weight in or doing a Kegel while you're inhaling, or they find themselves holding their breath. And you'll notice on the exercises on IntimateRose.com that we've instructed you to do a Kegel by inhaling and relaxing. So you're going to keep your entire body relaxed. And then on the exhale, you're doing the Kegel. So on the exhale, you're gently blowing out through your mouth as if you were going to very gently blow out one birthday candle. And at the same time, you're doing a Kegel. And that motion is meant to complement what the body does mechanically. And the reason for this is that the thorax, the area between the pelvic floor here at the bottom and the diaphragm here at the base of the rib cage, is like a high-pressured soda can. And if you hold your breath, that pressure remains in the thorax and all of the pressure goes down into the pelvic floor. So through the intestines, over the organs, and down into the pelvic floor. And if you're trying to do a Kegel against that, best case scenario is it's like a salmon trying to swim upstream. And worst case scenario is you can get a hernia. So the reason for the breath pattern is very specific, and it uses the body as a tool to offer the path of least resistance. And so if you're inhaling and doing a Kegel, when you inhale, the diaphragm is filling the lungs with oxygen, and that does put downward pressure. So we don't want to be doing the Kegel during the inhale. We want to wait until the exhale. The funny thing about breathing is we do it all day, every day. But as soon as you draw your attention to it, all of a sudden it becomes this very challenging thing. And then you add a Kegel on top of that, and it's a coordinated movement that a lot of people have never had to do. And it's a bit like learning to drive a manual transmission on a car. So don't be frustrated. It's very common to struggle with it initially. And just like a clutch, it can be very difficult to control at first, but once you get the hang of it, it becomes second nature. And it just takes practice. So if this is something that's particularly challenging for you, one of the ways to get better at it is to just practice that breath pattern and noticing what's actually happening in the pelvic floor without doing the contraction. So to do that, you'll lay down flat on your back and you're going to inhale. And when you inhale, you're going to allow your belly to rise up gently towards the ceiling. So you're just going to fill your abdomen with air, gently inhaling. And then you'll exhale gently out of your mouth, and your abdomen is going to come back down. You're not going to force it out. You're just going to let gravity do its job. So while you're lying there, breathe that way for a few minutes, and then start noticing what's happening in your pelvic floor while you're breathing that way. So here you are laying down, and here's your spine, and your head's going to be up here. And here's your pelvic floor, and your legs are down here, and your belly's rising and falling. What you'll notice is that on the inhale, there's a slight downward pressure on the pelvic floor, and on the exhale, it gently lifts up. And this is a very small movement. It's not going to feel earth-shattering. It's very slight. So start noticing that movement, and then you can start capitalizing on that by contracting into the Kegel with the exhale. Practice that in that position first, and then you can add the weight, and it will feel more coordinated, and it should feel a lot easier. For more educational videos, visit YouTube. For more Intimate Rose exercises, you can visit IntimateRose.com.